Hey folks, welcome back. Have you felt that off late your knees are creaking a little bit and that you have some knee pain? Well, you're not alone. Okay, 60% of the people are suffering from knee pain, and that's like becoming like a common thing these days. Remember one thing, that your knee is a weight bearing joint. So it bears the weight of your entire body, and therefore you've got to be very careful and very mindful of what exactly your knee is going through. Now, a little bit about your knee. Your knee also does not have that many muscles which are flexible. So your knee has more ligaments and tendons and meniscus which are not very flexible. So if you overstrain your knee in terms of any jerky movement or sudden movement, or if you've fallen down, that could definitely overstretch your ligaments or your tendons, and that could cause pain. Well, one of the first things that I want to tell you about your knee joint is your knee joint is a weight bearing joint. So if you're weighing 70 kilos, your knee is bearing 70 kgs. So be kind to your knee, and the first thing I want you to do is go and lose weight, because your knee cannot bear so much of weight. Imagine putting 70 kgs on that knee, and if you're more, God, that's scary. Now very often we feel that our knees are creaking and they're making some sounds. You don't need to be worried and scared about those sounds, because really and truly between the knee joint there is a fluid called the synovial fluid. Sometimes when the fluid starts drying up because of age or overuse injuries, like a sports player, then the joint itself causes some pain, because now there is friction. So the liquid is not there and there is friction over there. And so therefore you have to be very, very careful about the fact that there is less friction. So when there is too much of friction, there could be an early onset of arthritis or osteoporosis. It doesn't have to be anything to do with age. It's about the way you use your knee joint. So a lot of people, because of fears, don't use their knee joint. They do not do knee strengthening exercises. So for you to do knee strengthening exercises are very important. So guys, go out there and learn to do this knee strengthening exercise. I've made a really good video on my YouTube channel. Go watch that video and go follow those exercises, because that's what's going to help you. And now if you've already got a lot of pain, what you can do is don't stop your activity. Alter your activity, and at the same time ice your knees tremendously. Sometimes with a lot of inflammation, your knee will swell up. So putting ice pack on your knees and a lot of ice and sitting there for 10-15 minutes will help you. Another thing that will help you is when you elevate your legs. So I want you to lift your legs above your heart level and allow the bad blood to come back. And when you do that, that also relieves you a lot of pain. So I want you to know that don't be afraid because you have knee pain, or don't be afraid of getting knee pain. You've just got to learn to manage it better, and you've got to learn to prevent it. So therefore strengthening all the muscles around the knee joint are very important, which means you need to strengthen the upper thigh muscles, which is the quadriceps, which are going into the knee joint, then your back thigh muscles, which are the hamstrings, then your outer thigh and your inner thigh muscles, and your calf muscles. When you strengthen all these muscles together, the ligaments and the tendons also stay really nice and strong, and the risk of you getting any knee injuries or knee pains are very less. And last but not the least, be very, very careful of the kind of movements you do. Any jerky movements done on a regular basis will definitely cause knee injuries. So you want to be very, very careful, and yet don't be so careful that you don't do anything. And most important is your footwear. When you wear a lot of high heels, your calf muscles are always contracted, and so the angle of your knee joint, which is natural like this, starts to go down like this, and that also over a period of time could cause knee problems. So you want to be very, very careful of how you deal with it, rather than just pinpointing and saying that, hey, I got knee problems and I can't exercise. So you got to work your way around it, because not working out is not an option. Hope you enjoyed. I look forward to seeing you. Thank you and bye-bye.